Welcome everyone. Now that we've all introduced ourselves, I want to talk about some things that people say sometimes about breastfeeding. Like, what have you heard? It hurt, or my baby was too sleepy to nurse, or I didn't have enough milk. These are all common statements that moms make about their first experience with breastfeeding their babies, but each of these are challenges that can be overcome, and in some cases we can even avoid them. You see, birth and breastfeeding are actually connected. We have actually seen profound connections between your birth experience and your ability to get your breastfeeding off to a good start. There are common obstetrical practices, including medical, technological, and surgical things that are done to a woman during birth that can impact your success in breastfeeding. They involve the baby's ability to suck, breathe, and swallow, and of course they need all of those to work properly in order to breastfeed. Also, the mother's comfort level can be challenged sometimes by things that happen during the birth. And for example, when moms are separated from their babies right after birth to find out how much the baby weighs. Doesn't really matter. The baby's going to weigh the same amount right now as she does in 2 hours. So typically, if you think of breastfeeding as stage 4 of your labor, so the first stage is dilation, that's your early labor. Then the second stage is pushing the baby out. Third stage is the placenta, and then if you think of it, breastfeeding is the fourth stage of your labor. And this kind of helps you visualize the connection between your birth and the breastfeeding. The bottom line is the fewer interventions, the more likely you are to be successful in breastfeeding. And an intervention is things like an IV or fetal monitors, that's the straps they put over your belly, or internal monitors that they put to measure a contraction strength or the baby's heart rate or things like that. These are all interventions that can impact breastfeeding and the birth outcomes. So how do you avoid all of these? Well, Lamaze focuses on 6 healthy birth practices, and they are, number 1, let labor begin on its own. Walk, move around, change positions during labor. Bring a loved one, friend, or doula for continuous support. This means from your home to the hospital, over a shift change, you have continuous support. Avoid interventions that are not medically necessary. These are the ones that I talked about earlier. Also, when they break your water or strip your membranes, these are all things that are interventions. And if they're medically necessary, that's one thing, but a lot of times these are done routinely to women, often without even asking the woman what her opinion is of these. And we'll actually go through a list of them later, and we can talk about what the options are. The fourth Lamaze healthy birth practice is to avoid giving birth on your back and follow your body's urges to push. And the last one, number 6, is to keep your baby with you. It's best for you, baby, and breastfeeding. So, to learn more about all of these birth practices, Mother Me Doulas on Call has Lamaze Healthy Birth classes in 5 locations in the DFW area. There's either a 2-day weekend course or a 4 or 5 week series in Dallas, Fort Worth, or Allen. And in this class, you'll work with an instructor and other parents, and you'll talk about ways to make informed choices and help you examine the evidence. What is the safe and healthiest way to give birth and breastfeeding? And you know, these classes are not like all Lamaze classes are not the same. So we teach you, we're not the how to be a good patient class. This is more about what does the evidence say and what is best for my birth, my family, my baby. We believe that if your body can conceive this baby, then your body can grow it and birth it and feed it and parent it. So we go along those lines that birth is normal, natural, healthy, and safe. So you'll learn about normal chemistry and anatomy in birth, and you'll develop confidence that talks about you as a couple. You'll figure out what works best for you. And we'll talk about pitfalls like arriving too early to the hospital or what to do if there's back labor, and how to have a more positive experience. Then we also have a 3-hour comfort measures for labor and birth. This will give you practical hands-on experience to find comfort techniques, and we'll teach your partner how to use massage. We'll tell your partner what words to use or avoid, and this will help you feel completely supported in your natural labor. And then we'll also talk about our newborn care, calming, and massage class. This is a separate class, it's 3 hours, and it helps you know what a normal newborn looks like, acts like, and feels like. You'll learn an 8-minute massage technique that contributes to better feeding, sleeping, and weight gain. And you'll learn the secrets to the happiest baby on the block, the 5 S's, as they say. And we will talk about those ways to comfort a newborn, whether it's their immature neurological system that needs calming or if it's true gas or colic, which is actually pretty rare. Everyone loves this class. You can even teach other caregivers this 8-minute massage technique. So, first things first, if you're interested in those classes, let me know. We'll register at the end of this presentation. But first of all, let's talk about your care provider. We'll talk about that next. What are OBs and midwives, and what are the difference, and what's best for me?